Okay, so let's see if I can answer your questions and give you your signs. Let's start with some signs. Blood pressure is blood pressure. High blood pressure is high blood pressure. Prescription is RX, so it's RX for prescription. Medicine, drug is with your middle finger, is medicine. I don't really see a difference because you asked here, I'm not sure how to sign medicine and drug. I don't see a difference between them, so if you do, let me know what it is. The only thing I can think of is if it's used for a medical purpose, it's medicine. If it is a drug that you're thinking about for drug abuse, then it would be this kind of a drug. And it's done right here, like you're doing an IV drug abusers. Refill, you have to finger spell. So just take your time and finger spell it. Then there's doctor, and then waiting, and then pharmacy is the RX store. You asked, do I need to spell out the names, and you said some names are long and complicated, and you used hydrochlorothiazide. Yes, you do. And the reason that you do is because the patients need to become familiar with the names, and if they have a generic name, give them the generic name too. They need to know both of them. They also need to know what the drug is for. They need to know why they're taking it. Too often patients take medications, they don't know why they're taking it. They need to know exactly what they're taking, exactly how much they're taking, and why they're taking it. And don't just start finger spelling it, write them out. Let them see it fully spelled out. When you're asking, so what medications are you taking? It's better if you just let them look at the screen and let them look at their medicines. Don't start finger spelling stuff to them. Let them look at the screen and they'll tell you exactly what they're doing. You don't want any confusion on that. You want the patients to know exactly what they're taking, and you don't want there to be a confusion with drugs that can interact with each other. And oftentimes patients are taking medications that they shouldn't be because the doctors aren't talking with each other. So you need to make sure that they're not working with another doctor and not talking to you about that. So you asked how to sign some of these other things. So hello, how are you? How is your wife? How is your wife? And make sure that you do your with the full hand because it's possessive. Because remember that when you point, it's you, and when you have your full hand, it's your, because it's possessive. So then, how are your kids or your children? How's your family? Please sign slowly. I'm learning. Do you need a refill? And then, so you can just say, you need, and then spell refill. And then I would point to the drug. So you're going to have a list of them there, so point to it. And then you can say, are you going to wait? And they're going to know what you're talking about because you're talking about your refills. If it looks like, you say you have here, it looks like your drug is out, then tell them, you're talking about that right there. I will fax this. You can say, I will, and then you finger spell fax. If you want to say you need to call the doctor, you can call. And is there anything else I can help you with? Then there's other things to help you with. You said, give me about 30 minutes to get it ready for you. So you're going to say wait, and then 30 minutes. That's it.